So the pelvic floor is a group of muscles and ligaments that supports the pelvic organs, and it attaches to the front wall of the bony pelvis, to the sides, and then to our tailbone. Now the organs above it are the pelvic organs, so in a woman that would be our womb and our bladder and our bowels and back passage. It can also work to support our core muscles and our lower back as well, so it's extremely important to stabilise the pelvis and support those organs.
Pelvic health is really important for everybody, but in particular women. It's important to strengthen your pelvic floor muscles and keep them nice and healthy so you have a functioning bladder and bowel. They're important to stop leaks from your bladder and bowel, but they're also vital in helping you pass urine and pass bowel motions. They help prevent pelvic organ prolapse, and they're good for sexual function as well.
When patients come with me, they may have some leaking of urine, particularly around moments of stress. So it might be if they're coughing or laughing or dancing. We can have problems if you're actually struggling to pass a bowel motion. You might have issues with intercourse or a feeling of something coming down or a feeling of fullness or discomfort in the bladder. And some patients also come presenting of lower back dull aching as well. And so these are some of the common symptoms that we find.
Pelvic floor problems tend to affect women more than men because our pelvises do different jobs. Women are prone to hormonal variation throughout their lifetime, particularly during their menopause. They deliver babies. During pregnancy, there's additional weight because of the growing fetus and because of additional fluid. So there's additional pressure down on those pelvic floor muscles. And it's not just vaginal deliveries that can cause a problem. Even having cesareans, some women will experience pelvic floor problems after that.
There's lots of simple things that you can do to start to improve the problem. Looking at what you're drinking would be a good place to start, that you're drinking enough fluid, not too much, not too little, that you're avoiding things that might irritate your bladder. So for example, things that have a lot of caffeine in them or fizzy drinks tend to irritate our bladder. Lose some weight, stop smoking, be physically active, and one of the most important things you can do is do some pelvic floor exercises.
As with all muscle groups, if we exercise those muscles, we can strengthen the tone. It's learning to establish where is your pelvic floor, gradually contract those pelvic floor muscles, and then relax them and contract them and relax them.
You want to really think about what's going on down there. So starting at the back, around your bottom, draw those muscles up and forwards like you're trying to stop passing wind. And at the front, think about drawing up and forwards like you're stopping passing urine. So you're drawing up at the front, up at the back, feeling an up and forwards movement of the muscles. You would start off with doing a hold. The textbooks all say aim for 10 seconds. Most people would have to build up to that. Let the muscles go, have a little rest, and try again. Again, the textbooks say we're aiming for 10 repetitions. Not everyone will manage that. Have a rest, maybe 30 seconds, and then do quick contractions. So you pull those muscles in the same way, hold them for 1 second, and drop them down again.
We don't want you to start thinking about your pelvic floor when you have a problem, and we don't need to wait till pregnancy or postnatally to think about it. It's really important if you can proactively work your pelvic floor and do exercises. Sometimes with my patients, I'll try and say to them, when the kettle's boiling or the traffic light's at red, just try and do 10 quick squeezes, and learning to do them properly is really helpful and important. And there's lots of apps that can remind you and set alarms on your phone. It's really important to use trusted resources that are created with clinicians and evidence-based. I think in healthcare, lots of patients maybe sit on symptoms. They feel that they don't want to come and speak to anyone about it or share it with anyone. But really, as a GP or a nurse, we're not embarrassed by any conversation. We've seen all sorts, and we'd much rather speak to patients about whatever may be worrying them so that we can give reassurance. But also, we can do more if we catch these things earlier on in the process. And lots of the things we can do are not invasive pelvic floor exercises. We've got pelvic floor physios that we can use, and there's lots of things and advice we can give about lifestyle measures you can do to also help your pelvic floor. So rather than living with embarrassment and worry, and we know that patients will hold on to that worry and that can play out in other parts, for example, with your sexual relationship and maybe confidence to go to that party where you want to dance or that exercise class, rather than putting it off, we can talk about things that we can do to help. So I would definitely say, from the medical care point of view, we're not embarrassed, and we'd far rather help patients sooner on that journey.